We are live in Facebook and YouTube, and Assemblymember Kalra, you are good to start. You are live.
Welcome, everyone. It's great to see folks jumping on to the Zoom for the webinar. Already have 64 participants. I know we had quite a few sign up, so I'll give it one more second here as folks come on.
I keep doing this. Okay, can you just show me this?
I can be sitting here as well, if that's easier.
How do I get rid of this?
Well, welcome, everyone. I'm Ash Kalra. I'm very honored to represent California's 25th Assembly District here in San Jose. They say sometimes it's better to live in uninteresting times than interesting times. It would be nice to have a week or two of very uninteresting, dull times, but that's not the moment we're in. And while we are in this moment of challenge, I think it's incumbent upon all of us to do whatever we can to support one another. And in this case, as we join together this evening, share information, resources, and hopefully some inspiration to folks, so folks know that we are in this together. My office has received many messages from constituents alarmed about the federal government's plan from the Trump administration to share Medi-Cal recipients' personal information with immigration enforcement agencies. Even under, as I said, normal circumstances, people are always worried about their privacy. But now people are especially worried, especially given the politicization of healthcare and whether they can seek care without fear. We're already hearing about folks not showing up to clinics or ERs or for their doctor's appointments because of their fear. The plan that's being put forward represents a serious breach of trust in government systems. If people fear that their data will be used against them, they certainly may avoid care, and it makes communities less healthy and less safe. We all live as neighbors with one another. We want to make sure that all families, all children, take advantage of the healthcare that is in our community and those providers that care so much about them. I strongly believe that healthcare is a human right. The United States spends more on healthcare than any other nation, yet we do have some of the worst outcomes amongst wealthy countries. We have a lot of work to do. And in the richest nation in the world, certainly no one should die because they lack insurance or are underinsured, or because they fear, even if they do have that access, they fear accessing that healthcare. Until 2016, undocumented immigrants in California were excluded from Medi-Cal coverage. And California has since then expanded eligibility step by step to include all income eligible residents, regardless of immigration status, is something that we're very proud of here in California. Undocumented Californians are vital members of our communities, making significant contributions to state, local, and federal tax revenues and working in essential industries that keep our economy running. And you know what? Regardless of how they contribute economically, it's the morally right thing to do to ensure that everyone has access to healthcare, regardless of any other status or stature in our society. Today, you're going to have the opportunity to hear from Congresswoman Zoe Lofgren, Joey Cachuela, who's the General Counsel at the California Primary Care Association, Dolores Alvarado, CEO of Community Health Partnership, and James Thoma, Special Assistant Attorney General with the Office of Attorney General Rob Bonta. I really want to thank everyone for joining. We received many of your questions and shared them with our presenters, who will address them during their presentation. And if you do have additional questions after the presentations, please submit them through the Q&A feature, and my staff will follow up. Knowledge is power, and our goal tonight is to empower you with facts, resources, and next steps. Now it is my great honor to introduce Congresswoman Zoe Lofgren, who represents California's 18th Congressional District, encompassing communities in Monterey, San Benito, Santa Clara, and Santa Cruz counties. She currently serves as the ranking member of the House Science, Space, and Technology Committee and as a member of the House Judiciary Committee. She's also the elected chair of the California Democratic Congressional Delegation, and for many decades has stood up for our immigrant community, both here in Santa Clara County, California, and throughout this great nation. Congresswoman Lofgren.
Thank you so much, Ash, for your service and for hosting this important webinar about healthcare and privacy. I represent the 18th Congressional District, as you've said. It is a wonderful community, or communities for that matter, who value privacy and who value access to healthcare for everyone. I'm sure you're all aware that last month, Republicans jammed through what they called, or the president did, the big, beautiful bill. We called it the big, ugly bill. And since it's now become law, it's the big, ugly law. It's a bunch of bull. It guts Medicaid, Medi-Cal here in California, the nutrition programs, clean energy industry, the Affordable Care Act, which we enacted into law when Democrats were in the majority. They've reduced the support for that, and premiums are going to rise this next month, actually, at the end of next month. The estimate from the Congressional Budget Office is it will cut at least $500 billion from Medicaid and will force some 17 million Americans to lose their health care. In California, in the district I represent alone, over 300,000 people rely on Medicaid, many of them children and seniors. Thousands of clinics and hospitals will be at risk for closure, and hundreds of thousands of healthcare jobs will be lost as a consequence of these irresponsible reductions, primarily so there could be savings to give tax cuts to billionaires. The estimate is that some 28 rural hospitals in California are at risk of closure. And I'd like to note also that Medi-Cal in California pays for nearly 2/3 of the nursing homes in the state. So all of this is really very adverse to the well-being of Americans and of Californians. Now, the subject of your webinar is also the concern we have about the sharing of personal information. The Trump administration directed the Centers for Medicare and Medicaid Services, that's CMS, within the Department of Health and Human Services to share personal information of millions of immigrants and potentially their citizen family members with the Department of Homeland Security so they can ramp up immigration enforcement. Now, CMS entered into an interagency agreement that permits DHS, that's Homeland Security analysts, to ask questions of the federal Medicaid database. The data includes names, addresses, birth dates, other sensitive information for really millions of people. The Medicaid database is meant for administering health care and paying hospitals, not for locating people so they can be deported. This was done despite CMS officials' reported concerns that the sharing of such data would raise not only ethical concerns, but would violate federal law, including the Social Security Act and the Privacy Act of 1974. That transfer raises grave legal and constitutional questions. Under federal law, including the Health Insurance Portability and Accountability Act, otherwise known as HIPAA, a patient's medical information is protected. Health centers are not immigration enforcement agencies. Unless there is a clear and lawful subpoena or court order, providers are not obligated to share patient information with ICE or any other enforcement body. State attorneys general have already asked a federal court to stop the transfers, and I understand the attorney general's representative will go into that more after we speak, but that Attorney General Bonta, who has been just a champion, he's filed lawsuits whenever the Trump administration violates the law. I want to congratulate Ash Kalra and his colleagues in the legislature for providing funding to the Attorney General to bring these causes of action. He got an injunction just recently. But we know that the administration has often violated court orders. And so we're going to have to watch this and also continue to be active to protect patient privacy. This action, this Medicaid data sharing for immigration enforcement, was not really disclosed. And it was not subject to rulemaking as the Administrative Procedures Act requires, and it violates the law. It makes communities less healthy and less safe when people, as Aj has just said, are afraid to come forward and get the health care that they need. So one of the things that I've done with other Democrats in the House is to co-sponsor a bill, the Protecting Sensitive Locations Act, to limit what Trump is doing. From the pre-questions, people ask, what are we doing about immigration generally? Well, I'm, a former chair of the immigration subcommittee, a former immigration lawyer, and I used to teach immigration law at the University of Santa Clara Law School. So I have a long history with immigration and believe that we ought to have an immigration system that is functional, which we lack today. There are two bills that I think I've introduced that I think are important steps forward. The first is a bipartisan bill, the Farm Workforce Modernization Act, which makes sensible, straightforward, essential changes to the visa system related to our farm workforce. That bill, as I say, is bipartisan. It passed the House of Representatives twice when Democrats were in the majority. We've recently reintroduced it, but the Republicans on the Judiciary Committee would never approve it. So we're hoping our senators, because they're getting a lot of feedback from the agricultural sector, might move this so that we can move forward. But the bigger bill that I've introduced in the past and that Senator Padilla has joined with me this year is something called the registry. This bill really goes back to a provision of immigration law that started in 1929. Basically, it says if you've been here a long time, you have a clean record. I mean, you may not have your paperwork from an immigration point of view. You can step forward, register, and get your legal permanent residency. Now, the last time the date for that was updated, Ronald Reagan was president. The date selected was 1972. And so this bill would update the date and actually make it a ongoing rolling date because Congress is so, I don't want to be too negative about the legislative branch, but we have not been diligent in updating this. I want to also talk about something I've been doing along with Congressman Sam Liccardo, who is in the neighboring district, which is the House Democratic Litigation Task Force. This is a group of the House Democrats that is working to coordinate our efforts with litigants, primarily Democratic state attorney generals, as well as other parties who are bringing lawsuits whenever Trump violates the law, which seems like every week. Over the past 28 weeks, 371 cases have been filed against the administration. So far, more than 200 of these cases have been successful, getting court orders from federal judges that block or pause the administration's really lawless and unconstitutional actions. Now, I look forward to hearing Attorney General Bonta's staff. I'm very proud of what our state AG has done. Congressional Democrats are committed to holding the Trump administration accountable. And we will have an opportunity next year for the country to say whether we want the direction we've been going in to continue. So with that, I will yield back. Please know that you have a partner in me. And if there are things I can do to help you or your family or individuals, please reach out to my office and we'll do the very best we can to help. Thanks so much, Ash.
Thank you. Thank you so much, Congressman Lofgren. You're always such a wealth of knowledge and even more than that, a source of inspiration during these challenging times, knowing that you're there fighting for us, I think helps to empower all of us on the ground here, certainly in Santa Clara County. So thank you. And as the Congresswoman mentioned, and we will be hearing later from a representative from Attorney General Bonta's office, but there's been some recent, I think, updates in terms of litigation there that he can touch upon. But as was mentioned, we did give a lot of resources to the Attorney General's office just for the purpose, as we anticipated based upon the first Trump administration, that there was going to be a need for extra resources. And so he's been using those resources very well, very high success rate in the litigation. We'll hear more about that a little bit later. But up next, we're going to hear from Joey Cochuela, who's the general counsel for the California Primary Care Association, the statewide association representing California's community health centers and clinics. These are the clinics, these are the health centers that so often our community, especially our immigrant community, goes to for their both routine as well as more urgent care. Previously, he worked for the California Medical Association and as a healthcare attorney and federal prosecutor as an active duty JAG in the United States Air Force. Thank you so much for being with us here today, Joey.
Thank you, Assemblymember Kalra. Good evening, everyone. First of all, thank you again to you, Assemblymember Kalra, for hosting this community town hall. Very honored to join Congresswoman Lofgren, Dolores, and James to discuss this important topic. My name is Joey Cachuela. Like Assemblymember Kalra said, I'm the general counsel for the California Primary Care Association, CPCA. I think I can say with confidence that none of you have heard of us before right now, but you probably know some of our members. Clinics in your community like Gardner Health Services. We are a healthcare association representing California's community clinics and health centers, and those clinics provide care to roughly 8 million Medi-Cal patients every year. They serve 1 in 6 Californians, 1 in 4 Medi-Cal patients, and they are unique in that they are required by law to serve anyone who walks through the doors, regardless of immigration status or ability to pay. All that is to say, in a group this size, if you yourself don't get care at a health center, you probably know someone who does. And so the Trump administration's decision to provide immigration enforcement officials with the personal protected data of Medicaid enrollees, the private health information of millions of people here in California, it has an immense impact on health centers and their patients, many of whom are immigrants. And it really comes at a time of profound challenges for both health centers and the patients and communities that they serve. An increase in ICE presence in the communities around some of our health centers, patients who are already facing disproportionate barriers to accessing the care that they need are now going to have to navigate a system of work requirements, eligibility verification designed specifically to make it harder to access care. Our clinics, many of whom are already operating on thin margins and providing uncompensated care because it is the right thing to do, are wondering, hey, what does the future look like in the face of looming cuts to the Medicaid program? I paint this picture because the administration's decision to share private patient information with the Department of Homeland Security, for us, it's not just a breach of data and information. It's a breach of trust that comes at a time when trust and confidence and safety are frankly being eroded by the administration. And it flies in the face of longstanding patient protection laws like HIPAA, which exist precisely to ensure that personal health information is used only for care and for legally authorized purposes. Certainly not to facilitate immigration enforcement. Some of you might already know this, and I saw there was already a question being asked, but clinics, hospitals, private doctors' offices, other types of healthcare facilities are required to provide certain information about Medi-Cal enrollees, Medi-Cal patients, to our state Medicaid agency, who in turn report that to CMS. And that's all part of California's obligations to administer our Medicaid program. It is a long-standing requirement, and it includes information like Medi-Cal patient's name, address, date of birth, social security number, immigration status, and Medi-Cal ID number. CMS, in turn, is legally required to protect that confidentiality and security of that information and cannot just provide that to Homeland Security or ICE upon request. As Assemblymember Kalra referenced, in a past life, I was a federal prosecutor for the U.S. Air Force and then a healthcare attorney. And so, I know as well as anyone that despite what the administration may claim, one arm of the federal government cannot just hand over protected patient information to the other arm. It's not the way it works, for very good reason. Patient privacy laws like HIPAA are the backbone of patient confidentiality, and violating them in spirit or in practice destroys the trust that makes care at our health centers possible. For them, the trust is real. It is just as important to the provision of care as any medical device, any prescription, any medicine. That trust is what allows patients to walk through our doors, to share their story, and to get the care that they need without fear. Let me give you just a few numbers of the impact of this breach and the impact of the administration's policy changes. Since the administration took office in January of this year, our health centers have seen a 27% increase in patients delaying necessary care because they're concerned about immigration enforcement. Clinics have reported a 33% increase in patients expressing safety concerns when accessing care because of immigration enforcement. Clinics have, across California, have reported patients with chronic conditions like HIV, canceling appointments, refusing to re-enroll in Medi-Cal, and declining to seek treatment or to use any of the other important services and resources that health centers provide. Things like food pantries, for example. Patients who are US citizens or are otherwise lawfully present are canceling appointments because, frankly, they fear that any information collected and reported on them could be used to draw ICE to their friends and relatives. So why am I telling you all this? The data breach has created a chilling effect, and because of it, many people will miss critical opportunities to seek care, to seek prevention, early intervention, treatment, and ultimately people will suffer negative health consequences that were completely avoidable. That's the status of things, and so you might be wondering, well, why would I go seek care at my local health center? Frankly, why would I go seek care anywhere, for that matter? I want to leave you all with this, right? Even before this data breach happened, but especially once it did, and I know Dolores will go into this more, health centers have been working on ways to help patients feel welcome and to feel safe when they visit their clinics and to ensure their safety, whether that's putting policies and practices into place to ensure ICE can't just walk through their corridors, walk through their exam rooms, helping their health center staff understand their obligation to collect information from their patients that is necessary to deliver care, but nothing else that might jeopardize their patient's safety and their ability to thrive in their communities. At the local, state, and federal levels, from our elected officials like Congresswoman Lofgren and Assemblymember Kalra to our local partners like Community Health Partnership, our state partners like the AG's office, we are working to advocate for the stability of and resources for our clinics and the safety of their patients. And we are just so incredibly thankful for their support on this issue and many others. We're working with our agency partners to make sure that health centers can meet patients where they are, sometimes quite literally, whether that's through telehealth or visits from a mobile clinic, mobile van coming to their community to serve them there. We're working with our state Medicaid agency and our partners in the legislature and the governor's administration to strengthen in law, in statute, the safeguards around private patient information. All that is to say, we in our clinics are working like every speaker here tonight and so many other people to keep the Trump administration from eroding trust in the healthcare system. Because, look, the truth is, the data bears out, you all know this, When patients feel safe with their providers, they are more likely to get the treatment and the services that protects both their health and the health of their communities. I'm not going to sugarcoat things. I won't sit here and tell you that we can completely, reverse the harm that has already been caused by this data breach and so many other policy changes by the administration. But, I think we can stand as a united front to prevent it from getting worse. So again, thank you. Thank you, Assemblymember Kalra, for putting together this town hall and inviting CPCA here to offer our perspective and to share what we're doing. Our message and the message from our health centers to their patients is clear, and I don't think it's ever been more important. Your health and your safety come first, and we will fight in the legislature, in the courts, in every exam room, in every clinic across the state to make sure that nothing stands between our clinic's patients and the care they need. Thank you.
Thank you. Thank you so much, Joey Cachuela, for offering your perspective, your expertise, and a sense of hope. And as you mentioned, I think some of us have seen some of the videos of healthcare workers that have stood between their patients and masked federal agents, whoever they are, because they don't ID themselves in so many situations. Those healthcare workers are already heroes, but they're taking extra heroic actions to protect their patients. And it's inspirational as much as it's scary, because that's not what healthcare workers should have to worry about. That's not what any of us, whether we're the workers or the patients, should have to worry about. But I'm grateful that you're there to offer your counsel during this challenging time. And speaking of a healthcare warrior, it's now my pleasure to introduce Dolores Alvarado, who's the Chief Executive Officer of Community Health Partnership of Santa Clara and San Mateo Counties. Community Health Partnership is a consortium of 9 community health center organizations with approximately 47 sites located from Daly City to Gilroy. Dolores will share the perspective of our local community health centers, their staff, patients, and families, the on-the-ground perspective. Dolores?
Thank you. Good evening, everyone. Very special thanks to the speakers, our guests, and even more special thanks to Assemblyman Ash Kalra, a longtime supporter of community health centers, not just now, but from the very beginning. My name is Dolores, and it's my pleasure to be here. I'm here representing the community health centers of this consortium. And I wanted to just tell Joey, too, that 100% of our clinics are members of CPCA. We're very proud of that. In fact, 2 of the clinics were founders of CPCA, which is also a great thing. And the first federally qualified health center in California, if not in the nation, was in the little town of El Viso, here in our own backyard. And it's still there, part of Gardner at this moment. So we have a long history with our national association, with our state association, and with the community. Wanted to also share with you that there are 394,000 people who were served in 2024 in these 9 clinics, the 40-something sites. 80% are Medi-Cal at this moment. 80% of 394 folks. So imagine the loss that we're going to be experiencing over a period of time here if nothing changes. I want to echo the comments that Joey stated around trust and your comments, Assemblyman Kalra. We know that we are the trusted messengers between government, between local and state government, between the community and the clinics. Very strong relationship between the neighborhoods and the clinics, which of course that's how they grew up. None of our clinics were funded by government, none. They were all started by community organizing groups of women who didn't even speak English started these clinics. Now, one of the reasons that I believe has been able to help us hold together and continue providing services or certainly being open to providing services, and no one has shut the door down, is because of that trust. You know, these are the clinics, as Joey mentioned, that people go to not just for healthcare, they go for optometry, they go for dental, they go for counseling, they go for Meals on Wheels, they go for dancing, they go for support, you know, all these services that are provided. That is the core of a federally qualified health center. Like whole person care before whole person care was a popular term. One example, the largest clinics, there was an event at one of our clinics last weekend, and the CEO was terrified that they had spent all this money, you know, to bring all kinds of services, including free haircuts. And so they made room for a couple hundred people. 1,000 showed up. Now, this was outdoors, high immigration area, high immigrant area, but the trust, they knew that there would be protection there, and they showed up. So that gives you an example of how the things that we've had to do to change that, to continue to provide that trust. Another example of the trust that they have is through the board of directors. Federally qualified health center law or regulation states that 51% of the board members are consumers, are patients, are people who were born and raised next door to the clinic. One of our CEOs in San Francisco, born and raised in Chinatown, and that's where the clinic is, Chinatown, San Francisco. He can walk to work every day. So even though folks do have the fear, there's no question, they talk about it all the time, the fear, even before the data breach, you know, right after the election, that's when it started. The fact that they're still coming, even if it's, you know, through a fair or through telemedicine or through phone call or to a meeting, they have not abandoned us, far from it, and we haven't abandoned them. So that's a big lesson learned for us. I will tell you this, in December, so clearly 2 weeks or so after the election, we decided to hold town halls. And someone said to me, "You're crazy. This is Christmas time. Nobody's going to come." We had 3 town halls about, you know, how people were feeling, what could we do to help. We invited the Board of Supervisors. We had 600 people show up, 200 in Gilroy, southern part of the county, 200 in the middle of San Jose, 400 in the richest part of our county, in Mountain View, the northern part near the university, near Stanford. 200 immigrants came there on a Friday night, still in their work clothes. Their hands were dirty. They stayed, they had dinner, they had conversation with the Supervisor Margaret Abacoga, with the consul from Mexico, which also brought all of their protective services. Again, the lesson learned there is we can't stay alone. When this happens, we can't do everything alone. So what do? We pull together with our nonprofits, with our government, with our legislators, with our construction workers, with the city mayors, et cetera. That's the only way to approach what we're going through. One thing that frankly, I had not thought of until I started to think about what I wanted to share with all of you is the trauma that the staff are experiencing at this point. Because we talk about patients and we talk about children, and it's very important. And I often forget, I must say, you know, the nurse, the MD, the medical assistant, the front desk person, what are they experiencing? So the trauma we've learned about lately is unconfirmed false raids. There are evil people on this earth, you know, who paint their trucks green, park it near a clinic. They don't go in, obviously. And then people get really scared. Staff get scared and they start calling. And this has been going on in Santa Clara County for a while. None of these were confirmed. To this moment, none of our clinics in the Bay Area have been raided. None in San Jose, Santa Clara, San Francisco. We have not seen that at this point, but we have seen that army green, you know, truck driving by, parking at the midnight in front of somebody's house, parking 2 blocks away from one of Gardner's clinics. But turns out, again, they were not parking in the Target parking lot, the Target, again, close to one of our clinics. So if that doesn't give you the chills, that like what's going on here? Is it our own people coming against us? That's the psychological trauma there. We know that many staff, particularly the ones that are the lower paid, the medical assistant, the front desk person, have had to leave because their babysitters have either been detained and deported, or left the country. And so they're without babysitting, so they've had to leave their job. Patients are switching from, I have Medi-Cal, but I don't want you to bill. So I'm going to pay you, once a month for $10, whatever, $15, whatever it is. So it's called self-pay. And that's very sad because we worked so hard right in the state of California, as Ash mentioned, to get Medi-Cal for undocumented, et cetera. And at this moment, even though they do seek help, they come, but they don't want us to bill Medi-Cal. So we don't. The clinics are not billing, which has obviously an economic impact. The other issue that's causing a tremendous amount of harm and anxiety is the whole issue with public charge. Is going to the doctor a public charge violation? Is if I go to WIC and get my food stamps, is that a public charge violation? So there's a lot of anxiety and a lot of media showing incorrect information. There's one particular media station that is great at scandals. Many of our staff are immigrants themselves and refugees from countries where they were tortured, etc. This is bringing up all that trauma and all that fear and depression. So we now have patients, who remember that, but our staff are as well from the refugees themselves. Another thing that's going on is there's abusive behavior going on. The patients coming in, excuse me, the patients coming in, checking in for their appointment, and people are so tense and so angry that they start throwing comments at the staff. It's your fault. You guys did not protect us. You guys let these undocumented people in. So staff are immobilized at that moment. What do I do? Do I throw them out? Or do I serve them too as well? So there's anger, there's disappointment, and an increased loss of trust with government. What we have to do and how we have responded, and I know I'm running over a little bit, if you could just give me 2 more minutes. How we responded was by the town hall that I talked to you about. We mobilized very, very quickly, and we locked arms, as we like to say, with our immigration partners. We helped provide training for Know Your Rights to all of the staff of the clinics, with 100%. Developed internal communication procedures, sort of a code blue, code green, that kind of communication. Close the door, don't go outside, etc. Increased telemedicine services immediately, whether they were reimbursable or not. That wasn't the question. Let's just do it. And then we started creating and meeting very unusual partners, foundations, other people with money, folks who wanted to get involved in how to help the community health centers. So we started bringing that group in, people who had an understanding and perhaps were immigrants themselves many years ago. The questions that I'm getting on the Zoom is, well, what do we do? We feel immobilized here. We feel like we don't know what to do. Education is the tool here. It's the response to this horrible situation. Education around legal immigration resources that provides tools, funding for neighborhoods to hire their own attorneys. Help us, because we can help you as well, learn about the risks and benefits of obtaining Medi-Cal. We are in fact planning a huge campaign because we don't want to tell folks, don't apply. But we also don't want to say, apply for Medi-Cal and get the vaya bien, good luck to you. We want to do both. So we're working with our nonprofit legal communities and our community health centers to put together these training sessions. We're also in great partnership with one of our key immigration nonprofits, Amigos de Guadalupe. They're doing a lot of the training for us. They were also doing Train the Trainer. So we have that information that we're going to be sending out to all of you right after this session. How you can help is become a trainer, become a Know Your Rights trainer. We need in 3 languages, no cost to you, and the benefits are great. The Amigos de Guadalupe will teach you, and then you will be sent out. You can also volunteer as Rapid Response Network witness. If someone's, you would be called if someone is being detained. You show up, you document, you take videos, you do not intervene, you do not try to fight. But that's a very, really important thing to do, because when it goes to court, that you will have the video, you will have the information. If any of you are involved in media, please, 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 the messages we want to hear from our local newspaper, our local TV station should be informative, supportive, and resourceful. Don't just scare us to death. Give us the tools. Don't sugarcoat it either, but give us the tools. Don't make this a big way of, money making. So with that, I'd like to stop and thank you all so much. And one last thing, we're in the process working with the county, which I think this is really, really important. Sorry, Ash. Is the partnership with the County of Santa Clara here and the Community Health Partnership and the clinics is equal to none in the state of California. So we're working together to come up with systems and funding, sustainability methodology, knowing very well that Medi-Cal reimbursement is going to drop. So how do we keep those that are the most vulnerable and not break the bank? Because at the end of the day, we still have to have doctors. We still have to have the doors open. The money will not be there necessarily. And it's interesting how creative the County of Santa Clara, although they're bureaucrats and we love them, have been able to come up with good ideas, including our local hospitals. So with that, I thank you for your patience, and it's a pleasure to see all of you.
Thank you so much, Dolores, for everything that you do. And I especially appreciate you highlighting what the workers are going through on the ground, how challenging it is for them, the mental health struggles of having to deal with not only the patients having difficulties, but the changing of the laws and things that are coming out of DC, and the workers hear all that and have to, whether they're giving directives or not, they know that they're in a different world now. That's always been a challenging one. And so thank you for highlighting that.
You're welcome. Thank you.
And up next, we have with us James Thoma, who's with the California Attorney General's office, to help answer some of the most common questions that we've been hearing from the community. And James serves as a legal and policy advisor to California Attorney General Rob Bonta. Has been doing a phenomenal job in pushing back against the administration. James specializes in health-related matters at the California Department of Justice, a former litigator and legislative analysis in the state assembly. He also lectured at UCLA School of Law. So James, I have some questions for you, but I would first like to ask you to offer up any comments you might have right now.
Yeah, thank you so much, Assemblymember Kalra. I really appreciate the invitation to be here and to be with the other speakers here, which is a fabulous panel here. I thought maybe I could just, since I think my main role is to sort of enlighten about what the lawsuit is going on, if I could just quickly update about what that's about and what we're doing, and then answer any questions that you have after that. I do want to give a shout out to Joey and CPCA for their assistance in our litigation that the states have brought, which I will mention right now. And that is, to start off, the Congressman already mentioned it, on July 1st of this year, Attorney General Bonta, who led a multi-state coalition, I think it's about 20 states, which filed a lawsuit challenging the U.S. Health and Human Services Agency and their decision to provide access to individual personal health data to the Department of Homeland Security, which, as folks know, houses the Immigration and Customs Enforcement, or ICE. Our lawsuit was filed in the district court, the Northern District of California, and that's in front of Judge Vince Chabria. And in that lawsuit, we argue that the mass transfer of this data violates the law, and we ask the court to block any new transfer or use of that health data for immigration enforcement purposes. As previous speakers said, this is a great violation of trust. It's a dramatic change in federal policy and practice. And in addition to being a betrayal of trust, it violates the Administrative Procedures Act, which is a federal law, and the U.S. Constitution's spending clause prohibition on unfair conditions on federal funding. The update that we have most recently is that just earlier on August 12th, the court granted our state's motion for preliminary injunction, finding that we were likely to succeed on our claim that the HHS's decision to provide access to personal health data violated the APA's, that's the Administrative Procedures Act, prohibition on arbitrary and capricious rulemaking. So I will just note this is a preliminary injunction. It's not a permanent injunction. And so what that does is that temporarily blocks DHS from using that Medicaid data that they obtained from the states for immigration enforcement purposes. It also blocks HHS from sharing Medicaid data obtained from the plaintiff states for immigration enforcement purposes. And that injunction will remain in place either until the end of this litigation or until 14 days after the federal agencies complete what the court called a reasoned decision-making process that complies with the Administrative Procedures Act. So that's where we are right now, which is good news. But I do want to emphasize that that is a temporary block, and happy to answer your questions, Assemblymember.
Well, thank you for going into that. I was definitely going to ask about it because it is some very positive breaking news, although we're not in a moment with this administration to take victory laps at any time because, as you mentioned, it's temporary and we don't know what the ultimate result is going to be. And as Congressman Lofgren had mentioned earlier, even when courts do make orders, it's not like the administration always follows along gently. And so that being said, I do have some questions. Again, some of these are based upon what we've been hearing from folks. And so I want to start by asking if you can confirm for us what kind of data is known to have been shared in those breaches.
Yeah, so we have learned some things through the litigation. As you may have understood, some of this came out in the news first in terms of a leak. The data had been shared. We promptly followed with the inquiries and lawsuit. But what we've learned is that HHS has shared Medicaid data in at least 3 different ways. So, for example, on June 10th of this year, HHS gave ICE millions of individuals' names, contact information, including addresses, and claims data that it collected from several states as a follow-up to its financial review. Now, ICE claims that they were not able to use that data for immigration enforcement. But on June 14th, HHS gave ICE a spreadsheet with, again, contact and identifying information that was obtained from the main Medicaid database. It's called TMSIS. And that contains information from all states. And it is updated monthly, both from state-funded and federally funded Medicaid programs that includes names, addresses, phone numbers, demographic data, claims data, provider information. And so that's about 1.1 million people that were in these data files. And ICE had said that it had started to use that information for their purposes. And then finally, the third thing that I would mention is that there's this agreement that the Congressman made reference to. It's a data sharing agreement between HHS and ICE, and that is for the purpose of letting ICE obtain information about Medicaid patients, quote, identity and location, unquote. Although as of recently, ICE had said it had not started using that information. And now that we have the preliminary injunction, at least, they are barred from doing so.
Okay, well, in the short term, that's definitely a good thing. In terms of kind of a legal definition, what is considered an unsatisfactory immigration status?
Yeah, so I think it's a common term that's used. There's a federal law that says that persons who are not lawfully admitted for permanent residence or otherwise permanently residing in the United States under color of law are ineligible for federal Medicaid participation. And those persons are often described as having, quote, unsatisfactory immigration status, with the exception that under federal law, if care and services are for emergency treatment, then of course, then everybody should be treated. And so the Medicaid program does allow persons access, even at the federal level, for persons who are undocumented. So it largely means undocumented persons, but there are like very specific categories of different types of, what is that immigration status? I can try sharing some information from DHCS, which goes into more specifics about immigration status, but largely and generally, we understood it to mean like undocumented persons who are not eligible for federal Medicaid, although they are eligible for state Medicaid.
And what, we all can imagine what could be done with this data, but in your belief, especially, you've seen some of the documentation, what is your fear or the AG's fear, what the Department of Homeland Security could do with the data, and what can patients do to protect themselves?
Yeah, so I think DHS has been pretty clear that it intends to use, that address and identity information for immigration enforcement. But as you said, there is certainly a fear, well-founded fear, I would say, for that information being used for all kinds of purposes. And I'd rather not speculate. I don't want to create additional fear, but you can just imagine, given the actions by the administration so far, the kinds of things that they might do with, all this personally identifying information in terms of going after various persons or groups who they might choose to attack in various ways. In terms of what people can do, unfortunately, we can't give legal advice to patients. I wish that we could, but we're, Department of Justice, we can't do that. I do want to say that there is some information on Department of Healthcare Services. I'll try and post that later in the link, which does provide some information about qualified nonprofits that serve individuals with unsatisfactory immigration status for assistance along those lines. And there's some additional resources information that they've provided that I'm happy to post here in the chat as soon as we're done here. And give you that. But it is, I understand it is a very frightening time for many persons, and we're doing our best to protect and prevent that information from being used for what the administration has said they will certainly intend to use it for, which is for immigration enforcement.
Yeah, and Dolores was talking earlier about, when they have immigration forms, what have you, that their folks are showing up. About 7 weeks ago, I held an immigration town hall that we also provided legal counsel for, and we had 50 different individuals that actually were able to sit down with a lawyer from Pangea Legal Services, that Asian Law Alliance, and others. There are numerous nonprofit services that will provide legal counsel that obviously you cannot provide, but they're available. And so we definitely want folks to take advantage of those great organizations. One other question, separate from the Medicaid lawsuit, how does the federal government's reinterpretation of public benefits programs impact Californians?
Yeah, so this is a question I know that Joey and CPC are very familiar with also, and that has to do with these federal notices that recently came out that redefined what is a federal public benefit. Essentially, what it does is expands the range of services that cannot be provided to non-citizens and others who lack government identification. This is, again, one of these issues that for many, many years, the law and interpretation of law was different in the sense that like states and locals and so forth could provide certain services and that were not excluded from this definition of federal public benefits. So it overturns this longstanding guidance from the U.S. Department of Health and Human Services. So it'll affect a number of different federally funded programs, such as Title 10 family planning grants, health centers, various grants for mental and behavioral health services, substance use disorder treatment. So you can see the list is quite long, and California, along with some other states, have joined in to sue the federal administration in a separate lawsuit that is separate from the one that we were just discussing with respect to the Medicaid Privacy Act, to stop the effect of those notices. The stay of the enforcement of those notices, per what the federal government wants to do, there is a stay, so they're not enforcing that just yet. It is extended through September 10th of this year. So again, not very far, but we are litigating that, and we'll seek further injunctions to prevent that from happening. Just to know that those particular notices do not impact Medi-Cal, Medicare, or covered California, but they do impact those other programs. And again, later on, I will post a link to our website, or to our website, where people can find more information about that lawsuit, and the release that it contains additional information about that lawsuit that you're referring to.
And touching back again on the lawsuit that we fortunately have a temporary injunction put in place. To end with a kind of a downer of a question here, what happens if the Trump administration wins the lawsuit?
Okay. Well, so let me start with what happens if we win, I guess.
Yeah, let's start with the positive. Yeah. What happens if we win? What happens if we win?
Yeah, so if we win, and you can probably guess, similar to our preliminary injunction, it becomes a permanent injunction, right? It prevents the administration from doing what is now threatening to do, which is to use health data, which has always been understood to be limited to, for those particular programs, not for mass surveillance, not for this mass transfer of information to another agency for immigration enforcement. And so we would seek to permanently bar the agency from sharing that kind of data for those other purposes. But if we do not prevail, then yeah, the federal government will be able to access, Medicaid health data, which is, of course, as the people here know, is terrifying for many reasons. It's weaponizing data that should have never been used for that kind of purpose. It should be used for program integrity and for healthcare and so forth. But that is the danger, and that is why this is such an important lawsuit that we have brought California as well as a number of states along with us.
No, it's critically important, and we're grateful for it. I know a couple of the questions touch on just the fact that, why do we have to provide this information at all? Or, if everyone's has access to healthcare, regardless of immigration status, why do we have to collect it? And part of that is because we do have a collection of different sources that we pay our healthcare through. It could be private pay, it could be Medicare, it could be Medi-Cal, it could be the Children's Healthcare Initiative here in Santa Clara County. There are a variety of different sources, and that's a problem that's emblematic of our multi-payer system. This is my own editorial, not reflective of anybody else here, but that's why I strongly believe in a single-payer healthcare system. I think it makes things much easier in the sense that everyone's covered. You don't have to go through as many logistical hoops. Now, that being said, even under that system, a tremendous amount of the money would come to the federal government, so it wouldn't necessarily relieve of this particular issue. But in terms of having to parse through data, and the reason why we have to keep so many records, part of it is because of the way that our system is designed. In my opinion, by design, has become so convoluted. And in order for clinics to be able to have the resources to provide the care, or for especially public hospitals, county hospitals, they have to access a variety of different sources, mostly federal and state resources. So that information is readily available if the federal government is successful in getting that information. It's not like you have that information for the medical clinic purposes one day and the next day the information is gone. That's why this lawsuit is so important for all of us in protecting our communities, protecting our patients and our workers. I'd like to, James, as well as Joey or Dolores, if anyone has any other comments they'd like to make, I'd certainly like to open it up for any kind of final comments you may have, what you would like the audience to take away from this conversation and such.
Well, Ash, thank you for the invitation. I'm going to take advantage of it. There's one piece that is so important, and I neglected to mention it. Throughout this whole chaos, the chaotic time on the way from December until now, the one thing that I hear about every single day, no matter what meeting I'm with, no matter which clinic, is that parents are terrified of losing their children. That is a constant. So you will have some information that's going to be sent to you around making a family plan, a list of attorneys, again, vetted, bona fide, good attorneys, legal assistance from the law centers at no cost or very little. And let's not forget the children. They don't know what the heck is going on here. They just know that they go to school and their parents tell them, we're not sure if you're going to come back or not, or we're going to be here. This is what you have to do. Imagine that. So I leave you with that, and perhaps we can follow up later with this group on what what do we need to do to protect our children? We have a lot to protect our families, our patients. So now our children and our staff, our medical staff.
Yeah. No,
And I thank you again.
for that, that final comment. Joey, any final takeaways or things that you would like the audience to take away from this conversation?
Yeah, thanks, Assemblymember Kalra. I would say, just to emphasize something Dolores said earlier, education is one of the best ways that patients and members of the community can fight back and arm themselves. Go to your clinics, go to other pillars of your community. There are resources out there, know your rights, the legal resources that your office has provided, Assemblymember Kalra and others. Education is critical for this. And frankly, look, everybody, your care is worth protecting, right? Do not stop going to your clinic for care and treatment. Do not cancel your appointments. Do not drop your Medi-Cal coverage. The point is the fear and the mistrust. And know that the health centers, the clinics, every speaker that spoke tonight are fighting alongside you. And I would say, as long as you keep showing up for your health, we will keep showing up to defend it.
Thank you so much for those inspiring closing comments. And James, do you want to leave us with any final takeaways that you would like the audience to think about?
No, I think basically Dolores and Joey said it very well. I just want to thank you, Assemblymember Kalra. I think like these kinds of forums where people can arm themselves with education has been talked about is really important to understand what is going on with the administration, what the fights are truly about. And so I would just encourage people, as has been already said, to arm yourself with education information, share it with persons who know, because the more that people know what's going on right now in society, the better off we will be in terms of the fights for what is right. And to protect the law. So thank you so much for organizing this forum.
Yeah, thank you, James. And please extend our gratitude to Attorney General Bonta at the different forums you've been having, what have you. I know he's been sending representatives, and that's on top of all the litigation in order to show that the AG's office is there to protect everyone to the best of their ability. And I know that's something that we feel in the community, we feel heard, we feel listened to, and we do feel the fight. And that's really important right now, because I think all of us are getting kind of exhausted, and we have to know that we're kind of in this together, and there are going to be moments we're going to have to take our ups and downs and take a break and what have you. But we know the AG's office is not taking a break, and that gives us a sense of hope. And so I want to thank all of our presenters again for their dedication, our communities, and participation in this event. Congresswoman Lofgren, Joey Cachuela, James Toma. Also, special thank you to Teresa Gomez, Catherine Hyde, and Dolores Alvarado, and a couple of folks on my team, Tuan Nguyen and Juan Rodriguez, for all of them for working on putting this event together. Let people know, please, that our office is working on putting together some resources and FAQs from the Department of Healthcare Services. We will send this out to all the RSVPs shortly, but feel free to reach out to my office if you need anything, or if you have any follow-up questions to either my office or to any of our presenters today. I know that they'd be happy to do the best they can to continue to answer questions in the days ahead, especially as things seem to be changing every single day. And the last thing I'll say is this next week, we're going to be taking on legislation that regarding redistricting. And I don't want to make any commentary on that today. Would love your feedback on that, because it is going to come before us on a vote. And so please feel free to engage on that pressing issue as well, to let me know and let your representatives know in the legislature what your thoughts are on that, because that's also, I think, going to be one of the more important things that we're going to have to contend with in these next few weeks and months ahead. So again, thank you all so much for attending. We had a wonderful turnout today. Thank you all for being here, and we'll make sure to save this stream so that those that couldn't be here could take advantage of our wonderful presenters. Thank you all so much, and have a great evening.